Welcome to this new video dedicated to the CDM Notes feature in HIP. In this tutorial, we'll see how CDM Notes simplifies the medical documentation of your patient sessions. In the patient record, under the Medical tab, you can see in this example that a treatment episode for an ankle sprain has already been documented. 3 distinct sessions are listed: an initial consultation, a follow-up, and a final session to close the treatment. The preparatory questionnaire includes various sections to fill out, such as work incapacity, diagrams, and pain scale, and allows you to attach documents, which are all gathered in the Medical Documents section. In the follow-up session example, the questionnaire contains fewer fields to complete. This is to avoid repeating information that has already been provided in previous stages of the treatment. Let's now take a closer look at a questionnaire with a new example. Imagine the patient is suffering from back pain. We are creating a new treatment episode with a preparatory questionnaire for the first consultation. All customizable fields are available here, including diagrams that you can edit or complete as needed. You can adjust each section to suit your practice and fill in only the relevant information for the session. The diagrams offer various shapes and colors to help highlight and illustrate key details. As in our previous example, you can fill in the fields according to your needs: pain scale, observations, and other relevant information. For each session, you can also attach documents to complete the patient's file. Make sure to name these files clearly so they can be easily identified when grouped in the Medical Documents tab. Thanks to the integrated search tool, you can quickly find specific information by entering keywords. You can also add essential details in the Cave section, as well as personal notes that are only visible to you. For more information about configuring treatment episodes and understanding the difference between an encounter and a treatment, please watch video number 5. I hope you found this video helpful and that it will assist you in better documenting your medical appointments in HIP. See you soon in the next video.